everyone, I thought I would do a video for all of us for PPE. I know obviously it's been very difficult the last 2 months for us all us businesses. We are potentially opening soon, so obviously we want to avoid a second spike. So we want to keep everyone safe who's coming into our businesses, and we want everyone to work together to make sure that we're all safe and we're not spreading the virus, to ensure that we all try and stay open. It's been very, very difficult for all of us, all businesses. So the more we stick together, the more we maybe share this video to make sure that we're all using the right PPE, then we can ensure that we all stay open. So what I want to talk about is PPE, so that's personal protective equipment. The main things that we will need, so it depends on what kind of people you are seeing in your business and whether you're going to be within 2 meters or not. So this video in particular is related to a lot of people actually. So myself as an aesthetic clinic, it can be beauty salons, the beauty industry, it can be anyone who essentially does need to be within 2 meters of their clients, of their patients, when their business doors do open. So the main thing that you are going to need, that everyone's seen everywhere, is gloves. Okay, so we've got some nitrile gloves. Make sure they are disposable, please. Please try not to skimp on gloves. Let's not go to the petrol station and grab these. We need some nitrile gloves and they need to be disposable. Do not skimp on them, throw them away between each person. I will go through all of this with you. I would start buying these now before you open because they are currently quite scarce. It's quite difficult to get hold of a few things at the moment. So have a little look into these. So you have your gloves, they're the main things. And then next, depending on if you are doing an aerosol generating procedure, so I'll put a list of these at the end of the video so you can have a skim through and see if you fall under this category or not. Basically what it means is that if you do a procedure that produces aerosols, that you will need a different type of disposable apron / gown. So if you fall under the AGP category, you will require a disposable fluid repellent gown. What that means is that it will have to come down quite far to your wrists, and it will have to be disposable, and it will have to be fluid repellent. The other type of gowns that there are, or aprons, is the disposable plastic aprons. Again, please do not use these between each patient. Make sure that you do change these between each patient. It only takes a little bit to pass on this virus, so we have to be quite diligent with this. So as I said, depending on what category you fall under, so your gowns, your aprons, so whether that's your plastic apron or your gown, your fluid repellent gown, depending on if you are classed under AGP, so aerosol generating procedures. This can be, for example, I'll give you an example. So dentists, when they do drilling, for example, that is an aerosol generating procedure. Again, I'll put the list underneath this video. The next thing that we need is our filtering face piece respirators, sorry. So everyone's seen these floating around, our masks. Just make sure that you are buying the right thing. Again, I will put the guidelines on here, the government guidelines. Just please don't skimp on these. These are the main things we've been seeing everywhere, and they are quite pricey, but to ensure, again, safety of us, our patients, businesses, and ensure we stay open and we do not spread this virus any further, that we buy the right stuff. Next, we will need filtering face pieces, eye face protection. This needs to be from the forehead all the way down past the chin, and it needs to cover each side of your face as well. So I'm not sure if you can see this in the video, but again, it just goes around the head. As I said, it needs to cover from the forehead all the way past the chin. This is your eye protection, okay? This isn't your mask, this is your eye protection. You can also use goggles. I haven't purchased any because I won't be using goggles. I will be using this. So you can use goggles as well. So I'll reiterate, I'll go through what we need. So depending on if you are seeing people within 2 meters or not, I'll put the guidelines on the bottom of this video, but you will most definitely need your gloves, disposable. You will definitely need your FFP, so your masks. You will definitely need your eye protection. And you will need your gown, again, depending if you can have an apron, if you are doing AGP procedures or not. You will have to look at that. In the aesthetics industry, we are doing lip fillers, we are doing anti-wrinkle therapy, so we have to be quite diligent. Even in other industries, the beauty industry, if you are bringing people into your business, into your premises, make sure that you are doing a risk assessment beforehand. What is the risk in your premises? Are people going to be within 2 meters of each other? If so, what can you do to change this? Can you make them wait outside until their appointment? Can you make sure that they are on time for their appointment, not 5 minutes early, not 10 minutes early, not 10 minutes late? Make sure they are on time. This will ensure that you are not seeing other people within your parking lot, within your premises. This will reduce the risk greatly. Another important factor that we need to think about is cleaning, disinfecting. So make sure, no matter what industry you are in, that you have enough adequate time set aside between each patient, each client, each individual to disinfect your clinic or your premises. This will ensure the reduced risk of spreading the virus. So I hope you find this video informative. As mentioned, I will be including the links for the information, the government guidelines at the bottom of this video. If you do have any questions, please feel free to ask me, but as mentioned, the government guidelines are quite clear. We all need to stick together to make sure that we can all stay open and we don't spread this virus any further. The NHS has been absolutely amazing and we don't want to jeopardise that at all. That, I don't know, did I say that twice? That is a delivery.
Up and down,
I don't know, that is what your industry is something of, no. In the aesthetic industry,